High blood pressure, the silent killer. Warning signs you can't afford to miss. Welcome everyone to the U.S. Health Guide. Today we're going to delve into a critically important yet often overlooked topic, high blood pressure, the silent killer. Why silent? Because unlike many other illnesses with obvious symptoms, high blood pressure often progresses quietly without any warning signs, even when readings reach dangerously high levels. You could be living with it for years without knowing, while it slowly damages vital internal organs. Alarmingly, in Vietnam, the prevalence of high blood pressure among adults is quite high, and nearly half of diagnosed patients do not have their blood pressure under control. So how can we identify and proactively protect our health from this invisible enemy? What is high blood pressure? Understanding your numbers. First, let's understand what blood pressure is and how to read your numbers. Blood pressure is measured with two numbers. Systolic blood pressure, the top number, is the pressure when your heart contracts to pump blood, and diastolic blood pressure, the bottom number, is the pressure when your heart relaxes between beats. Both numbers are crucial. So what are the safe thresholds? Normal blood pressure is below 120 to 80 millimeters mg. If your readings are between 120 to 139, 80 to 89 millimeters mg, this is considered pre-hypertension. And when your blood pressure reaches 140 to 90 millimeters mg or higher when measured in a clinic, you are diagnosed with high blood pressure. Notably, some international health organizations also suggest an earlier diagnostic threshold, starting from 130 to 80 millimeters mg, indicating a trend towards earlier intervention to prevent complications. Remember, understanding your numbers is the first step to taking charge of your health. Silent symptoms to watch out for. As mentioned, most people with high blood pressure experience no clear symptoms in the early stages. The only sure way to know is through regular blood pressure checks. However, as the condition progresses or in cases of sudden, severe blood pressure spikes, hypertensive crisis, some silent or non-specific symptoms may appear, requiring heightened vigilance. First are frequent headaches, especially in the early morning, 2 to 5 a.m., concentrated at the back of the head, occipital region, and forehead. High blood pressure increases pressure within the brain's blood vessels, causing them to stretch and irritate pain receptors. However, it's important to note that headaches are not always a reliable indicator unless blood pressure is extremely high. Next is blurred vision or vision loss. If you notice blurred vision, double vision, distorted vision, black spots, or even sudden vision loss, be cautious. Prolonged high blood pressure can damage the small, delicate blood vessels in the eyes, leading to retinal hemorrhage, edema, or optic nerve damage, potentially resulting in permanent vision impairment if left untreated. Persistent fatigue, difficulty concentrating, forgetfulness, or a feeling of brain fog, difficulty thinking clearly, can also be subtle signs. High blood pressure reduces blood flow and oxygen supply to the brain, causing chronic cerebral ischemia, which affects cognitive function. Chest pain, discomfort in the chest, and shortness of breath, especially with mild exertion or when lying down, are more serious signs. High blood pressure forces the heart to work harder, eventually leading to heart failure or pulmonary hypertension. Finally, frequent unexplained nosebleeds or heady and difficult to stop bleeding can be another sign to watch for. High blood pressure increases pressure on the small, fragile blood vessels in the nose, making them prone to rupture. However, similar to headaches, nosebleeds are generally not a reliable indicator unless in a hypertensive crisis. Emergency signs: seek immediate medical attention. If you measure your blood pressure at home and notice a sudden spike to 180/120 mmg or higher, this is an emergency situation that requires immediate attention. Crucially, call emergency services immediately if this dangerously high blood pressure reading is accompanied by any of the following symptoms: severe chest pain or shortness of breath, sudden, severe headache, sudden vision changes, blurriness, double vision, vision loss, numbness or weakness on one side of the body, difficulty speaking, slurred speech, or trouble understanding language, dizziness, loss of balance, or difficulty walking, nausea or vomiting, seizures, confusion, lethargy, or loss of consciousness. These symptoms could signal a hypertensive emergency or a serious complication, such as a stroke or heart attack. Devastating consequences of uncontrolled high blood pressure. Uncontrolled high blood pressure is one of the leading causes of premature death and disability globally. Persistent high blood pressure continuously strains blood vessel walls and organs, leading to cumulative damage over time. For the heart and blood vessels, the heart is forced to overwork, leading to thickened heart muscle and heart failure. Arteries become stiffer and narrower, atherosclerosis, increasing the risk of heart attack or stroke. For the brain, high blood pressure is the most significant risk factor for stroke. It also affects thinking and memory, leading to vascular dementia. For the kidneys, high blood pressure can damage the small blood vessels within the kidneys, impairing their filtering function and leading to chronic kidney disease and kidney failure. For the eyes, high blood pressure can damage the blood vessels at the back of the eye, causing retinal hemorrhage, optic disc edema, and even permanent vision loss. Additionally, other complications include metabolic syndrome, erectile dysfunction, and sleep disturbances. Prevention and management. Proactively protect your health. Given the silent nature of the disease, proactive prevention and management are key to protecting your health. Lifestyle changes are a crucial foundation. Adopt a heart-healthy diet. Eat plenty of vegetables, fruits, whole grains, lean meats, and fish. Limit salt, sugar, processed foods, and unhealthy fats. The DASH diet is an excellent example. Engage in regular physical activity, at least 150 minutes of moderate intensity aerobic activity per week, about 30 minutes most days. Maintain a healthy weight, as even a small amount of weight loss can help control blood pressure. Limit alcohol consumption and quit smoking, as excessive alcohol raises blood pressure and smoking damages blood vessels. Finally, get enough sleep, 7 to 9 hours daily, and manage stress through meditation or exercise. The importance of regular blood pressure monitoring cannot be overstated. It is the only way to detect and monitor the condition early. Measure your blood pressure at home using an automatic upper arm cuff monitor for 3 to 7 consecutive days every morning and evening, taking 2 readings each time, 1 minute apart. Debunking common myths. Don't let common misconceptions hinder effective disease management. High blood pressure is normal with age. False. High blood pressure is not an inevitable part of aging and needs to be treated. I feel fine, so I don't need to worry. False. High blood pressure often has no obvious symptoms for years. Feeling fine does not mean your blood pressure is normal. Lifestyle changes are enough. No medication needed. False. Lifestyle changes are a crucial foundation, but many people still need medication to effectively control blood pressure. If my blood pressure is stable, I can stop medication. False. High blood pressure is often a chronic condition that requires lifelong management. Suddenly stopping medication can be very dangerous. Take charge of your health. High blood pressure is a serious public health challenge, but we can absolutely take proactive steps to address it by understanding the disease, being vigilant about potential silent signs, adopting a healthy lifestyle, and especially by regularly monitoring your blood pressure, you are protecting yourself from dangerous complications. Don't let the silence of the disease deceive you. Be proactive in checking your blood pressure, consulting healthcare professionals, and implementing necessary preventive measures. Your health is in your hands. Please share this video to spread this important message about high blood pressure. Don't forget to subscribe to the US Health Guide for more useful health information.